Let's take a pause because I'm sure we might feel a little bit convicted here that we're mentally fragile. So is it my fault if I struggle mentally? Is it my fault that I'm fragile, right? So this is another concept called biopsychosocial model. This kind of tells you all the factors that comes into the health of the mind, okay? What makes it fragile, what makes it resilient, these are all the factors, okay? And under the biological, we have general medical conditions, IQ, genetics, biochemical imbalance, intrauterine exposure, which is a fancy word of saying when your biological mom was pregnant with you, did she use any medications or substance, right? Substance, current or history of substance use. Do you see that this is biological factors, okay? That goes into the health of the mind. Psychological factors like mood, sensory comprehension. So some people might be a little bit more sensitive to loud noises or textures, right? These are something that is different in the spectrum. Personality, emotional resilience, like we mentioned before, ability to focus and ability to relate. So these are all the factors under psychological factors that affects the health of the mind. And social, your friends, sense of community, upbringing, parenting that you received or didn't receive, okay? Bullying, hobbies, trauma, these are all social factors, maybe external factors that affects the health of your mind. And in my training, we stop there. But I think as I'm getting more confident in my training, there's a huge miss if we don't mention the spiritual aspect of our mental health. And this is not limited to Christian, convictions and doctrines. I think spiritual, we can kind of understand sense of belonging, sense of purpose, right? Sense of meaning in your life. Christianity and God has an answer for that, but I think we all have these spiritual questions when we were born, correct? So, can you imagine if you had a sense of purpose, belonging, and meaning, how much healthier your mind would be, right? So this is a huge aspect that I incorporate in my practice, and it's been wonderful. So out of all these factors, what can we control or change? Do you think we can control all of it? No, you guys are smart. So I highlighted something that we can actually control. So whether not the history of substance use, but what can we do about your current substance use? Your emotional resilience, like we said, if we start lifting the weights, it can grow over time. Ability to focus, unless you have ADHD, but even if you have ADHD, you can kind of grow that ability to focus over time. Ability to relate. Friends, you can choose your friends. You can choose Grace First Baptist Church as your community, right? Your hobbies, which hobby do you want to do? And spiritual, I highlighted as a green because sense of purpose, belonging, and meaning, I think is a gift from God, but we can ask, right? So do you see that we cannot control a lot of things that goes to the health of the mind? It's very small fraction. So a lot of times there's people who say, is it my fault that I'm struggling being mentally fragile? Well, what do you think? Yes and no, but it's not 100% of the responsibility. Is everybody tracking? Say, yes, ma'am. Yes, ma'am. All right. So what's the difference? So we talked about being mentally fragile and mentally resilient. We talked about all the factors that goes to the health of the mind. So what's the difference between mental health issues that we'll have today and mental health disorders, okay? So in statistics, this is called normal bell curve. And this is a diagram to show that it's a general fact that all the population will fit under the curve. So the theory is that a lot of people will be in the center of the curve, like median and average people, and there'll be less and less people that's less than average, right? Outliers, okay? So everybody fits under that curve. So let's take an example of blood pressure. So in medicine, we kind of drew the line in that population to say, this is a cutoff, and after that is called hypertension or high blood pressure, okay? So for category number 1 hypertension is 130 to 139 for systolic, the top number, and 80 to 89 for diastolic, okay? And the criteria is that, if you're having like a stressful day or if you just worked out, your blood pressure is gonna go up, right? So the criteria is that you have to have 3 separate readings to be this high to qualify to be a category 1 hypertension. Do you agree that? You guys have heard about that, right? And there's category number 2 hypertension, and the cutoff is higher, 140 plus for systolic and 90 plus for diastolic. Yeah? But in medicine, even if it's evidence-based, this line in the sand is a little bit more arbitrary and less medical than you think. So when we draw the line, we have to take into account for public health concerns, okay? So what is a risk of diagnosing? So then they're gonna start taking medications, right? Do we have enough meds for all the people who will be taking the medications? And then risk of not diagnosing. So what is the risk of not diagnosing, and then they have a critical consequence of not diagnosing? And just like I said, do we have enough meds? Do we have enough doctors? Do we have enough doctor's visit? All these things are not really medical related, but it helps us to draw the line in the sand. Does that kind of make sense? So these are the symptoms of depression and anxiety disorder. And it's like depressed mood, loss of interest, weight loss, weight gain, can't sleep or sleeping too much, or excessive worry about various topics, worry that's difficult to control. The reason why I'm not focusing on this is I want you to kind of get the big picture. I don't want you to read this and be like, oh, I have anxiety. And I'll explain why, all right? So let's take fatigue for an example. So just like hypertension, we need 3 separate readings in a different time to do that. In psychiatry, we have lists of symptoms, but we have a criteria of these symptoms to meet a diagnosis, okay? So fatigue is one of the criteria, but let's take fatigue for an example and go assess it in a normal bell curve, okay? So everybody's gonna have different level of fatigue, right? Most people are gonna feel somewhere in the middle, and there are gonna be people who are really tired all the time, or not tired at all, okay? So we draw the line in the sand. So let's say that even in the fatigue criteria, there's a cutoff, okay? And we say, ooh, after this line, this is pretty significant fatigue, and it can meet the criteria for depression. Now, you need to do many other criteria to meet depression, but just imagine with me. I put the smiley face there, just under the cutoff, okay? So imagine somebody with a blood pressure of, so the cutoff was 130 over 80, right, to meet hypertension. What if somebody was 129 over 79 3 different times? They didn't make the cutoff, but are they healthy? See what I'm saying? Just because you don't make the cutoff doesn't mean, oh yeah, I'm free, I can eat whatever I want, I don't have to exercise, right? Like I don't have to change my lifestyle. You're just missing the cutoff doesn't really mean anything. We're all going towards being healthier, right? And what if, on the other side, let's say that somebody's working out, doing all the right things, and they're 131 over 81. Are they screwed because they got the diagnosis?
No.
We just continue working on ourselves, continue to think that we were doing. So do you see that a diagnosis doesn't really change the journey and the destination? It's just a diagnosis. So whenever I talk about diagnosis with my patients, I said, don't get married to a diagnosis, first of all. Second of all, psychiatry doesn't have a blood lab. It doesn't have a number. So a lot of times, it's the relationship of things that they're telling me. And a lot of times, maybe the bigger fire is more evident by interview. And then in a few months, I'm like, you know what, tell me more about that. Like, what's going on there? So sometimes diagnoses change and different things kind of come up, right? So psychiatry is a little bit more vague than hypertension, but even with hypertension, do you understand everybody's on a spectrum? There's no shame or relief of not having a diagnosis either way, okay? So do I need medications? So just like hypertension, let's say that you're hypertension number 1, you just got diagnosed. Do you think, well, some doctors might, but do you think doctors are gonna be like, okay, then here's the 3 hypertensive medications and pick it for the rest of your life? No. A lot of times they'll be like, okay, you just got diagnosed, okay? Start exercising a little bit more, start cutting out some salt, they're gonna recommend lifestyle changes, okay? So just like in diagnosis of depression or anxiety, if you just met the diagnosis, some doctors might, prescribe I can't really preach on how everybody practices, but if the symptoms are just new or it's not as bad, then you can kind of say, well, let's do some therapy first, right? Let's get you involved in hobbies. Let's get some behavioral changes to see if it'll work. That's a valid treatment option, okay? It's not that after you get diagnosed, everybody's on meds, okay? But just like if you got diagnosed with hypertension number 2 right away, right? Your blood pressure really high for some reason. We might recommend medications, right? And you're doing all the lifestyle changes. There's nothing that more you can do to lower your blood pressure. Medication might be an option. So how we measure that in psychiatry is how severe are the symptoms and how long have the symptoms been present, okay? And also an interesting term is mental health burden. So how much is depression or anxiety causing burden to your day-to-day function? Are you able to not pay bills, go to job, maintain relationships? So these are the ways that we kind of measure in psychiatry of how significant the mental health burden is. Is everybody kind of tracking?
Yes.
Yes. So